Hi, my name is Beau and I'm the Endorsed Midwife working at Athena Women's Clinic. And today I'd like to talk about what an Endorsed Midwife is and what my role is in caring for you in your pregnancy journey. And I have the pleasure of working with women and their families throughout pregnancy and in their postpartum. And I work alongside Dr. Soma here, our GP obstetrician, to provide quality, compassionate care throughout pregnancy and in the postnatal period. So you might be wondering what an Endorsed Midwife is, and endorsed midwives have extra credentials in their qualifications that allow them to prescribe pregnancy-related medications, request blood tests and order ultrasounds so that they can monitor your pregnancy and provide autonomous midwifery care throughout the pregnancy experience. So what are the benefits of having an endorsed midwife look after you throughout your pregnancy experience? It means that you have continuity of care throughout your pregnancy, and you get to know me as your care provider, and I get to know you to learn about your needs and wishes in pregnancy, your labour and birth experience, and your postpartum journey. And what we know about the benefits of having a private midwife look after you throughout your pregnancy is that the research tells us that women are more likely to have vaginal birth. They are less likely to have unnecessary medical intervention, and they have better outcomes in terms of successfully breastfeeding and healthier baby. So the maternity care that I provide is evidence-based, which means it's supported by the best available evidence to ensure that you are having a healthy pregnancy and your baby is healthy. But pregnancy is not just a physical experience. It also involves the mental and emotional experience of the woman and also her spiritual experience as well. So I really enjoy getting to know my clients as individuals and learning about their unique needs in pregnancy, birth and postpartum, because it's really important to realise that you have lots of decisions to make in this really a special time, and you have a lot of choices available to you as well. And what you choose might be different to what someone else might choose. So it's really a good idea to start to learn about what's important to you and how I can support you on that journey. So today I'm going to talk about the antenatal period and what you might expect in your pregnancy appointments with me. So when you find out you're pregnant, you will often attend your GP to confirm the pregnancy, and your GP will offer you some blood tests to check on your vitamin levels. They will offer you sexually transmitted infection serology, and also any other blood tests that might be relevant to you and your pregnancy. This will be a period where we will start to organise and plan for the next few months of your pregnancy. And your GP will offer you a request form for your first ultrasound of pregnancy, and that's also known as a dating scan. And in that dating scan, this will determine the estimated due date for the birth of your baby. And once the pregnancy is confirmed, you will often have your first appointment with me in the clinic, and this is also known as the booking in appointment. So this appointment is often at least 1 hour long, and this is where we get to know each other, and I ask you lots of questions about your medical history, your family medical history, your partner's health as well. And I also talk about your emotional well-being and see how you're feeling, offer any support or referral for allied health or other supports out there. At this time, I will talk to you about your pregnancy care plan, and I will offer you an ultrasound for your anatomy scan. And this anatomy scan is a really important ultrasound that is done at around 18 to 20 weeks. And it has a look at your baby's physical growth, and also can detect some congenital disorders. And after that, I often like to see my clients every 4 weeks at least. So around 16, 20, 24, 26. And then from then fortnightly, 28, 30, 32, 34 and 36 weeks. And 36 weeks is a very important discussion we have in preparing you for labour and birth. And I always encourage my clients to bring along their partner or birth support person to this meeting so that we can talk about what your needs are and preference are in labour and birth. After the 36-week appointment, I like to see you at least weekly, and so that I can check up on your pregnancy health, monitor baby's well-being, and you get to ask me any questions that you have in relation to preparing for birth. If you are feeling nervous or have any fears, we can talk through them so that you are at your best for when labour does happen. And alongside the care I provide, your hospital where you will be birthing will like to see you at around 28, 36 and sometimes 40 weeks of pregnancy as well. So they get to meet you and you get to familiarise yourself with the place that you'll be birthing in. And sometimes you will be referred to the hospital earlier in pregnancy if we have identified any risk factors that require a little bit of extra monitoring in a hospital setting. But we also have the benefit of having Dr. Soma available for any medical related checkups throughout pregnancy. And you will always see Dr. Soma at least once or twice throughout your pregnancy so that she can offer her input, and I will always refer you to see her if I have any concerns about your pregnancy. So each appointment is a really important opportunity for me to monitor your health. At these appointments I check your blood pressure, I listen to baby's heart rate, and from around 24 weeks I start to measure your uterus to check that the uterus is growing as we would expect. And around 34, 36 weeks, we start to really feel for baby's position. And I like to get an idea of what position baby is in leading up to the birth. And there's lots of things we can do to optimise baby's position in the last few weeks of pregnancy so that baby is in the best position for a smooth labour progress. So you will often have an appointment with the hospital at 40 weeks around your due date. This is an opportunity for you to chat about your labour and birth plans as well. And this will be an opportunity for the hospital just to talk about plans if you were to go past your due date and any possible need for induction of labour. Once you have birthed your baby, you have the opportunity to return to this clinic for midwifery postpartum care visits. So that's an opportunity for me to see you and your new baby, and I get to monitor how you are going physically and emotionally in the postpartum period. Throughout your pregnancy, it's a really good opportunity for me to offer you education and support leading up to birth. And there are lots of really great resources out there that you can equip yourself with knowledge and tools to have a really positive labour and birth experience. The hospitals themselves offer labour and birth preparation classes. It's really good, especially if it's your first time, to attend a breastfeeding class and also bring along your partner so they get to know how to support you in this really special time. And every woman has a unique vision about their labour and birth experience, and it is my goal to work alongside you collaboratively to educate and support you in making the right decisions for you and your family. And if you're interested to learn more about having a known midwife care for you throughout your pregnancy experience, you can visit our website.